My name is Carly Rutledge. When I was 16, I was diagnosed with Ewing sarcoma, and they gave me a 6% chance of survival. I survived because of a cutting-edge immunotherapy vaccine trial. When the Rutledge Foundation asked me to make this video, I immediately agreed and just knew that finally I could make a difference in how we treat kids with cancer and help others to have less toxic, more curative therapies. So I want to tell you about the journey that I went on making this video. In July 2016, I visited the Day family in Portland, Oregon. Their son Sam had been fighting Ewing sarcoma for 6 years.
I am Lorna Day, and my son is Samuel Day, and he has Ewing sarcoma. His prognosis was originally supposed to be pretty positive, but he relapsed. Once someone with Ewing sarcoma relapses, the prognosis is much poorer. He's had to deal with a lot of treatment. The thought of putting him back on something that makes him sick again is obviously heart-wrenching to me. Traditional chemotherapy isn't even working for Sam anymore. That's my #1 priority in life, is to keep our kid around.
1 month after I left Portland, Sam passed away because there were no more effective treatment options for him. I knew that there had to be a better way to treat kids with cancer.
The Sam Day community has contributed quite a bit to the Rutledge Foundation, and I feel so good about how that money has been handled. Things are moving forward. They're changing lives in incredibly dramatic ways. They are bringing healing to people who desperately need it and deserve it.
The Rutledge Foundation's mission is threefold: to bring awareness and focus to the over 1 million adolescents and young adults who are battling cancer, and then also to identify and care for their needs, and importantly, to bring innovative approaches to curing the cancer that we have not seen changes in over 30 years.
I feel like the Rutledge Foundation has definitely catered to my emotional and physical health. Being a young adult at a kid hospital, it's helped me see or go to events that there's all sorts of different types of ages there. It's awesome to have.
Chemotherapy, radiation, surgery, it is just so toxic and changes their lives forever.
Well, I'm John Immunitis, Director of Mary Crowley Cancer Research Center. I've been involved with the foundation for several years in development of Ewing's treatment therapeutic approaches. So there's increasing evidence that an immuno approach indeed could come in and help where chemotherapy can't, and that's in patients who are already failed frontline and second-line treatment. I think it's pretty logical to think that this could be something used in second line and really up to frontline, but we have to prove it. And so we're working with the FDA right now to get that proof. You got to ask yourself, why can't we go and try that cutting-edge new therapy in Ewing sarcoma? And we have. And with that, if you can give that to patients and not have side effects, well then you're starting to come up with more and more evidence on why you can take this to children with Ewing sarcoma, to teenagers, to adults with Ewing sarcoma.
And we've come so far in this short period of time. With your continued support, then we can complete this work that we've started. It's laying the groundwork to cure Ewing sarcoma.